All right, guys, let's get started. You have all the materials that you need in your hands, and I have my laptop, and we can actually I can look at my laptop and do this. All right, so here we go. So we discussed already microbes, what they are, okay, how we view them. We started off on bacteria. We said that we have different shapes, and we classify them by shape and arrangement. We first talked about bacteria, the cocci, and we say cocci were what? Round, right? We said cocci were round. So, we also discussed that we have bacilli that are in rod or rod shape. Those are your bacilli. And we also discussed and said that we had some called spirillas. Okay? So, on your cocci, we discussed that there was which was the different types of cocci that we had? Yes.
Streptococci, diplococci, staphylococci.
Okay. And so, by diplococci, what do we mean? In pairs, okay? And staphylo?
It's one.
In groups. And streps? In chains. And we gave you examples of those. Can you give me an example of a staph bacteria? MRSA. What's MRSA stand for?
Methicillin-resistant staphylococci virus.
Staphylococcus aureus. Okay. Strep. MRSA. Methicillin-resistant Staphylococcus aureus. Okay. MRSA.
Can we just go, do you want us to say MRSA or can we just say MRSA?
We always say MRSA or MRSA. But in the hospital, you'll hear us say MRSA. Okay. All right. All right. So we were talking about the cocci. Well, now we're going to discuss bacilli. Okay. We did a little bit we talked about how your, did we start bacilli?
Yeah, Spirilla.
We talked about bacilli, so we talked about your bacilli being, rod shapes, and we talked about your, syphilis. We talked about syphilis, right? Okay. So, and we started off with STDs. We talked about your spirochetes and your Vibrio cholera, right? Did we talk? Yeah, we did talk about Vibrio. Remember, we said Vibrio cholera is found in raw oysters, and it's one of the foods that we say we need to make sure that that we are very carefully. We're going to eat them raw. One of the other ones that I think I discussed was the VRE, vancomycin resistant enterococcus. And remember I said that one, the doctors, they overused it on babies. And so now we have a resistant enterococcus to that particular vancomycin. So that's another one that you guys have to be very careful with, okay? All right, so now we can talk about, and then we have new ones. It's called MRAB. Your MRAB, that one is an example of a bloodstream infection. Anytime you have a bloodstream infection, it is the hardest for us to get rid of. The reason it's so hard is because it's in your blood, and so we're not trying to medicate you via IV. So we have to have you in the hospital. We can't send you home with antibiotics. And we're trying to get rid of that infection that traveled either from another site. Okay, for instance, you had a UTI, and we said a UTI was what? Urinary tract infection, and it was a UTI that we didn't take care of properly. And so now that bacteria that caused your UTI, which is usually, for the most part, E. coli, has now traveled to the bloodstream. Okay? Yes, sir.
Can males get UTIs?
Yes, sir, they can. Yes. The reasons that we get UTIs, one is that we wait too long to go to the bathroom. Okay? So that urine is sitting in our bladder. And even though our bladder is considered a sterile environment because it's enclosed, if we already have bacteria, and the longer our urine sits there, it'll grow. The bacteria will start multiplying. Why? Well, sometimes we have glucose in there. If we're dropping glucose in the urine, they have something to feed off from. Okay? We sometimes can also have white cells. We shouldn't find any of those things in there because normally urine shouldn't have bacteria, shouldn't have, white cells. We shouldn't have sugar. But if we do have those things, then that means that there's something else going on in the body that is bringing, clearing all that stuff through the kidneys into the urine. Okay? So, yeah, males can have UTIs as well. Bless you. And then the other one that's up there is your CRE. These are your resistant, carbapenem resistant enterobacteriaceae. Those are new. And again, why? Because when we give people medications, your antibiotics, and we're asking you to take your antibiotics, you guys don't take them the way you're supposed to. You either start feeling well after the second day of taking the meds, and so you decide, oh, I'm just not going to take it anymore, I'm fine, and you stop taking the meds. Yes, sir.
So what if you forget a day? Like, do you just resume the next day?
Yes.
Like, that's the best thing?
Let's say you were supposed to have taken your medication at 8 o'clock in the morning, and now it's 8 o'clock in the evening. You're to take it, and now we're just going to switch the time that you're going to take it the following day. Some medications are every 12 hours. So if you missed your 8 o'clock time, you should have taken it again at 8 o'clock in the evening. So now we're going to switch out. You're going to start at 8 o'clock in the evening, and then your next dose will be at 8 o'clock in the morning, and then you start off from there. Yeah. Your antibiotics are not like your pill, where if you miss a day, you can take that day and make up for it. Yeah. And the pill is what we give girls when their menstrual cycles are not normal, and that's why you can't do that. If you miss that day, that's it. You can't say, well, I'll take it today and then continue. No, because the pills are labeled with the dates, and so once you miss it, it's going to throw everything else off. So antibiotics are a little bit different in that sense. You can still manage to take it in the next dose. Okay? So any questions with your bacteria? Okay? So we talked about the 3 different kinds that we have, cocci, bacilli, and then your Aspergillus. We discussed about different types of bacteria for each one of them. Okay? And so now we're going to talk about protozoas. Your protozoas are one-cell animal-like organisms. These can be found in decaying materials and contaminated water. This is what we have to be very careful when we're out there in the ranch or hiking, because you never know what has fallen or what is in the water, especially if it's not running water. Okay? When you have running water, it's a little bit different, because in running water, as it's in a stream, it's constantly moving and running, so everything that's coming down should be fresh, okay? And it's taking everything down further along the stream. When you have stagnant water, okay, and like a pond, it's different. If an animal dies right at the edge of that pond, well, all of that decaying material goes into the water. And so now you have bacteria and protozoa growing in the water. So if you drink it, you can get sick. This is where you're gonna have your flagella for movement, and you have some that are pathogenic. Okay. One of the ones that we talk about that causes disease are malaria. Malaria is carried by a mosquito. The mosquito has the malaria protozoa in them. They bite you. It leaves the protozoa in your bloodstream, and then that protozoa goes into your red cells and multiplies in your red cells. So what malaria is doing now, in order to get out of the cells, it ruptures the cells, okay, to go back out and lay eggs in other red cells. This is why people that have malaria, first they have the fever, but also they will suffer from blood loss and anemia because the red cells are being destroyed by the protozoa. Every time the protozoa gets out of the cell, it ruptures the cells. Okay? You also have amoeba dysentery. This is an infection in the intestinal tract by an amoeba. It gives you diarrhea. Okay? And you'll shed the eggs of the amoeba in your feces. So we literally we ask you to collect feces, and then in the lab, we look at the stool under the scope and we look for the eggs of the amoeba, or the actual protozoa in the stools.
What was that called?
Amoebic dysentery, AMEDIC, and then dysentery, DYSENTERY. And then we have also trichomonas. Trichomonas, the one that we look at is called Trichomonas vaginalis. And the reason it's called Trichomonas vaginalis is because it's actually found in the vagina of females, and we can find it actually in the urine of females. If we find it in the male urine, then we know the male has been with a female that is infected. Okay, because we shouldn't find it in males.
What are the symptoms of that?
Usually when you have Trichomonas vaginalis, you'll have itching, burning sensation. So we treat with antibiotics because we see it's considered a UTI. And then what verifies it for the doctor is that we actually see the Trichomonas vaginalis in the urine moving around. And it actually, we call it the little clown face because it has two nucleus and they look like eyes, and then it has a bunch of little arms that move, that help it move in the urine. Yeah. But that's how we find it. Okay. And then the last one under is African sleeping sickness. Okay. And just like the name says it, African sleeping sickness, that means that the patients get bit again by a mosquito that's carrying the disease, and the patients get fevers. The protozoa causes sleepiness, and the patients go into a deep sleep and they die. Okay. Questions on your protozoas? Anybody? Okay. We're gonna move on to fungi.
African sleeping sickness, they get bit by a fly?
It's a fly, yeah.
It's a fly.
It's a fly, not a mosquito. It's a fly. Yeah. It's a fly. And again, this is why, if you've seen here in the States, we have those nasty big flies that are like this big.
Horse flies?
Yeah, they're about this big. You have to be careful, okay, because those will bite you. The little ones not always bite, but those big ones will bite. And of course, flies stand everywhere, okay? They stand in the dirt, they stand in the trash cans, in trash, in dead material, feces, and then they fly and they stand in your food or in the water. So now, and every time they stand somewhere, they're actually laying eggs. Okay? Yes.
Why do you want to
Huh?
Why do you want to they're like, I don't want to say eating or what are they?
Yeah, when the ones that bite, they have a little point that comes out of their mouth, and that's what they sting you with. Yeah. But every time they sit on something, they're actually laying eggs, guys. Okay. This is what we tell you: don't let the flies get on your food, because they're actually, every time they sit, they're eating, but they're also laying eggs. Okay. So any other questions on protozoa and which ones we have? All right, so let's go to fungi. Your fungi, these are your plant-like organisms. You're gonna find them in live, they're living in dead organic matter. That's why we find them in trunks of trees, okay? You can find them in the edges of the pond, and in other areas. We actually use yeast for bread. We also use yeast in beer for the fermentation. And we use it in our bread to help it rise. Because once you mix it in the bread and you let it sit for a couple hours, that yeast starts fermenting, and so it starts the rising of your bread. In beer, it does the same process, okay? But we have some yeast and some molds that are pathogenic to us, okay? You have things like, which one are they giving you here? The yeast that causes vaginitis, okay? We also have the yeast that forms in the mouth. It's called thrush. And this one looks like white patches on the tongue. And what happens is that when you find it, the babies or the children, the tongue enlarges, that the tongue falls out of the mouth and they can't close their mouth, and then you'll have all these white patches on the tongue. That's a thrush. Okay? It's a fungus.
Is it something contagious?
Yes, like a fungus, it can be transmitted. Yeah. That's why when we know that they have thrush, we tell them they have to use a separate spoon, fork, knife, cake, glass, whatever. You don't want to transmit it, pass it on. Yeah. What an athlete's foot? Yes. Athlete's foot. It is very common, and I'll tell you why it's so common, athlete's foot. Because, and that's why they call it athlete's foot. When we are wearing our socks, okay, we stay with the shoes, and they're always, it's a perfect environment for the yeast to grow. It's dark, it's moist, okay, and so it'll grow faster. It attaches to anything and everything, okay? So this is why we tell you guys, after you're done playing sports, take off your tennies, take off your socks, and put on sandals. You know, those slip-on sandals. Your Reeboks or Adidas or whatever. Why? Because you want to let your feet dry up, and you want your feet to breathe outside of those shoes, okay? When you go all day with those same shoes and you get home and you still go on and you don't take off those shoes and then you reuse them the next day, you're not letting those shoes breathe and dry up. And because again, it's a dark, moist place, your fungi will grow in there, okay? That's why you get your athlete's foot. There's also what they call a jock strap, the jock itch in boys. Why? Because they wear that to do the sports, and sometimes they just go on and they don't take it off. It's material that is wet, okay? And again, it's a moist, dry place. It's a moist, wet, dark place. Perfect for that, okay? And that's why now they tell the boys, as soon as you're done practicing with football or soccer or whatever, go shower, take it off, you know, dry up. Because we want to prevent that from happening. And places like in your locker rooms, in your showers, in your gyms, we tell you to wear flip-flops when you go into the showers. Because this is how your athlete's foot is also transmitted. If one has it on their feet and they're standing in the floor of the shower, okay, whoever comes next can actually potentially obtain that fungus from that other individual. It doesn't have to be directly me touching his feet with my feet, but me standing on the area where he stood, I can contract after you stood. Okay? That's why we tell you don't wear somebody else's shoes either, for that same reason. Okay? So you need to be very careful with your fungi. Now, fungi, we do not give antibiotics because antibiotics do not kill fungus. We give antifungal medication. Antifungal medication is a long treatment that can last up to a year. Okay? So what we do is that we test your liver because unfortunately these medications are so strong they can actually hinder your liver. So what we do is that we test your liver, make sure that your liver is okay. We start you off in the meds. We give you the meds for a period of 6 months, and in between those 6 months, we reevaluate your liver. We have you do another blood work for your liver to make sure your liver is working fine and it hasn't, the medication hasn't affected it. Okay? Questions with fungi? No? Yes, ma'am.
Is there a medical term for acidic food?
No, we just
No.
call it acid foot. Yeah. Yes, ma'am. Okay. The next one we're going to talk about is rickettsia. Your rickettsias, okay, these are parasitic microorganisms that we are going to find in a living cell. Your rickettsia cannot live outside a living cell, okay? So they require a host in order to survive. We will find them in fleas, lice, ticks, mites, and so they'll bite us, and that's how they transmit it to us. So the ticks, the mites, the lice, these are all a vector for us to get infection.
Was the black plague the kids?
Yes, because it was the fleas from the rats. The rats were infested, and then the city of England was infested with rats, and because they didn't really have also very good hygiene and very good ways of getting rid of waste, because they were so overpopulated, this is why it was transmitted so fast and so many people died. Yeah. Okay. Some of the ones that we see now are typhoid fever, Rocky Mountain spotted fever, and like I said, these are very common. We still actually find them, and the reason we find it is because we have people that go hunting, we have people that live in ranches, and so you're out there, and if you're not careful, all it takes is one bite from that tick or that lice, or and so we give you antibiotics, okay, for them, but it does not mean that we kill it off completely or we get rid of it, okay? We treat the symptoms and the signs, and we get your immune system to kick in, but when your immune system drops again, then you're going to have that typhoid fever or Rocky Mountain spotted fever come back up, okay?
So basically, it's not curable.
Yeah, it's sort of like, remember, I don't know if I told you about mononucleosis, the kissing disease that we call it, and it's actually adult teenagers. It's the same thing. We treat the signs and the symptoms of mononucleosis, but once you have it, that's it. You have it. It doesn't go away.
It stays in the body.
It stays in the body. It stays in your system. So we get your immune system to get healthy again. But with stress, another illness, you will get the mono will creep up again and get you sick. Signs and symptoms of mono are tiredness, fever, very lethargic, achiness. So it's not a pretty sight. No kissing. That's the prevention. No kissing. And we know, and that's why we call it the kissing disease, because we find it the majority of the time we will find it in teenagers, your age, and even early 20s. We'll find it in there. Yeah. And
You can't just like whitewash.
once you kiss somebody, it's, and this person has it, they're carrying it. We call them carriers.
I feel like some people like go to the doctor and then they don't want to tell anyone, and then they their parents find out they have like a boyfriend.
Well, you'd be surprised. We have so many clinics out there that will see teenagers without their parents, and so they're
Seek
free
help.
clinics. Yeah, they tell you to seek help, and you go seek help, and then they don't tell your parents because now it's confidential. It's between you and the facility. But yeah, I mean, that's why we say abstinence is the best thing to do. Okay? Questions with your rickettsias? No? Yes, ma'am.
The Rocky Mountain, what did you say?
Spotted fever.
Spotted?
Rocky Mountain spotted fever. And that's why these are all fevers, because what happens with these, and there's a bunch of them in this line, your fever spikes up, and then it comes down, and then it spikes up again, and then it comes down. So the doctors are kind of like, well, what's going on? So then you get your infection control practitioner involved, and this is where we start questioning you. Where have you been? What have you eaten? What have you done in the last 48 hours? And that's how we start putting it together. Okay. We had, when I was doing infection control, we had a young man who had gone hunting for rabbits, and the rabbits had the fleas, and they bit him, and it was a wild rabbit. They killed it, they cooked it, they ate it, and then exactly 24 hours after he ate the rabbit and he had been out there, he got really sick. They couldn't figure out what it was until the infection control practitioners, Ms. Jones and I, we started digging around to see what was going on, where he had been, what he had done prior to getting sick, and we found out about the rabbit. Needless to say, we were a little too late. By the time we put all the puzzle together, because nobody knew and nobody wanted, the friends he went to didn't want to say anything, but he literally started losing circulation to his feet, so his feet got black. His heart, his lungs, his kidneys, everything started failing. We had him on a ventilator. By the time we said, okay, it's this, we need to treat with this, it was too late. He died, yeah. That's why you have to be very careful.
Because he ate the rabbit, or because they bit?
One was the bites, but also the meat that he ate was contaminated with the...
And what about his friend? Dang, that sucks to have friends like that.
Well, I mean, and that's what we tell you. You gotta be very careful, because, sometimes they don't want to say anything, and so, we were able to get him to say, but then it was too late. By the time we started getting medications to him and stuff, it was too late. He died. Yeah. So you have to be very careful. Okay? So
Was he
questions
wait.
before we move on? Yes.
Did he go hunting by himself, or was he with people?
No, he went with a couple of friends. They went hunting for rabbits, but rabbits is another one you have to be very careful of. Yeah. That's why I tell you not to hunt wild rabbits and eat them, because bless you, they're not.
How do you know if you have lice?
How do you know you have what? Lice. You'll have heavy itching, but you can actually see the lice in the head. Yes, ma'am.
In third grade, I got lice at daycare, and it was very unpleasant because everyone in my family got it, and I like washed my hair, and they were all in the tub. It was really
Yeah.
Yeah.
The lice are, even though they're tiny, they're white actually, and you can actually see them in your hair. They jump from person to person, okay, and that's how when you're in a group of people like a daycare, and they're not careful of washing their hair, just being healthy, and being healthy in the sense of having your routine of showers and bathing and things like that. Those things can jump from person to person. They actually grow like that. Okay, they lay the eggs, and the eggs, they don't only lay one, they lay many at one time. And so once that one lays those eggs, that's it. You're infested. You'll see them on the pillows and stuff. So yeah, we have to wash with a special soap and comb your hair with a special comb. And
I couldn't use the soap because it made my asthma mess up, so my mom just like coated my hair in mayonnaise.
Well, you do it with vinegar.
yeah, but
Vinegar.
yeah, I mean it's just horrible. And then the itch and everything else you have to deal
But
with.
isn't it like people with short hair? Well, they can get it, but it's like they don't.
Easier to get them out of short hair.
Like, cause my sister got lice from this kid in second grade. Like the whole class got infected.
Yeah.
And so, like, even though I didn't have any lice, like my parents still treated me and stuff like that. And then I was asking my dad, and he was like, "Well, you're not supposed to. Like, people with short hair don't get it." But
You have hair, you can still get them. It will be easier to get rid of somebody who has really short hair like you guys than somebody who has long hair like us, because they dig through. I mean, they literally, you'll pick up the hair and you'll find them down here, up here, and because we have so much hair, it's a lot harder to get rid of somebody like us. You guys with this short hair, well, it's a lot easier to treat, maybe twice, and that's it. But we do treat everybody because they jump. Okay? They jump from person to person. So yeah, you gotta be very careful. Okay, so let's move on. Any other questions with this one? Because we're gonna hit viruses. Okay, viruses are next. And so viruses are the smallest microorganisms that we have. We have to use a special microscope called the electron microscope to be able to see them. Okay? This little guy actually require a living cell to reproduce. They are either RNA or DNA in nature. Okay? So they use our cells, our DNA, to replicate.
Oh.
One example, they're very difficult to kill, yes. These can spread through the bloodstream and body secretions, and we cannot use antibiotics or antifungals to kill them. Okay, we can't. None of that stuff will kill them. We have to use certain antiviral medications, and only some will die. So they actually require our DNA to replicate. Perfect example is HIV. Okay? HIV requires our DNA because HIV is RNA in nature. And because it's RNA in nature, in order for it to replicate, it needs our DNA, okay, to be able to replicate within our cells. So when that happens, it goes from cell to cell to cell, and the one cells that they actually use to multiply are the T cells. Okay, they use T cells to multiply. You guys, the common cold, it's called the rhinovirus. That is the actual medical term for your common cold. rhinovirus. And I don't know if you guys have seen that there's a commercial where there's a rhinoceros. They put a rhino in the commercial because rhinovirus, and they use the rhino to tell you about the cold. Okay, you get it? So, rhinovirus is actually your common cold. Okay. Your rhinovirus, like anything else, is transmitted person to person. Sneezing, coughing right next to a person. The droplets are small enough for us to breathe them in fast, and that's why we catch it. And then when we're enclosed in a small place with a lot of people, it's a lot faster for us to get sick with it. Another one is your measles, your mumps, chickenpox, your herpes, warts, influenza, and polio. These are all viruses, okay? Okay? These are all viruses. Polio, we were able to eradicate with vaccinations.
Didn't one of the presidents have that, Roosevelt?
Yes. President Roosevelt had polio, and that's why he had that limp and he was on a wheelchair. We also gave vaccinations for mumps, measles, chickenpox. We now have a vaccine for what is it? Herpes, and then we also have one for the HPV, human papilloma virus. HPV causes cervical cancer. Yes. HPV causes cervical cancer, and that's the one that that's why we vaccinate the young ladies with the new vaccine that's out there, because there is a certain form of, there's many HPV viruses under it. They have different names, and they use numbers, and so there's a certain strain within that HPV that causes cervical cancer.
There is one for the flu also.
Huh?
There is a vaccine for flu.
Yes, we vaccinate for flu also, and it works when we have the right one for the right flu.
That's right.
But because again it's a virus and it's constantly changing, the vaccine that we could have given last year will not work this year. So yeah, yes sir.
Didn't they like screw up this year with the flu shots and stuff? Like it was the wrong one. Wasn't that in the news, or was that not this year but last year?
I haven't had one of these.
I don't take the flu vaccine because of my allergies. And when we had that outbreak a couple of years ago, where we didn't know if it was flu A or flu B that was out there, and the vaccine that they created really fast to help eradicate what was going on had a lot of side effects. I just never take it. If I need,
Is that kind of like the thing, like parents don't believe in like vaccinating? Like,
well, no.
kids, kind
The only reason I didn't take it was because
No, I'm
I
saying,
didn't.
but like, do people choose it like that? Like, do some people not take it because they want to vaccinate their kids?
They use religion and they use other things to say that, but you really should vaccinate your children, because if you have a child, for instance, every child when it's born gets certain vaccines at one point, and then we have to wait a certain amount of time before we can vaccinate you for other things, okay? So if between that time you happen to be at a park or a daycare and one of those children is not vaccinated, and they actually have, let's say, the measles, and they go to mom says, oh, they're okay now, and they take them to daycare, that little baby that has not been vaccinated yet for the measles because it's not time yet will get sick and die. Same thing with chickenpox.
And can you sue?
I mean,
Wait, is this thing recording us?
yeah. Yeah, we are. We are.
I just realized it.
I mean, you could take it to court. I don't know how the court would, really truly handle it, but it is our responsibility to not only take care of our own, but make sure that we don't get anybody else sick. We'll go back to, remember that guy with the HIV virus that knew had the virus, knew was sick, and continued to have unprotected sex with all those females. And then he ended up in jail, and he died in jail. Okay? He was found guilty of reckless endangerment. Okay? He knew what he was doing, he knew he was sick, and yet he went ahead and did what he did. Okay? So yeah, you could be taken to jail, and probably most likely, end up in jail. Okay? So there's nothing for the cold, the common cold, because it's seasonal, and so people, unless you're immunocompromised, you will not die of a cold. Now, if you're immunocompromised, yes, you can die. Immunocompromised means that your immune system is low, and you don't have enough white cells to fight off the infection that you are being presented with. People like with cancer that are going to chemotherapy are one example. HIV patients who have what we call full-blown AIDS are another ones that are at danger, okay, of dying from a simple cold. Okay, so we have to be very careful. Some of the other ones, what happens with your viruses, guys, and that's why right now we still haven't been able to find a vaccine for HIV, is because since they're using, every time they infect somebody, they're using somebody else's DNA, it's constantly changing. So if we were to look at the first HIV virus at its genetic makeup, and we look at what we have now, it has completely changed from the original one. Okay, for that same reason, because every time it attacks another individual, it uses that DNA and it replicates and it changes. Okay, so we have that. Some of the other ones that I don't know if you guys remember, maybe you were too young. SARS, S-A-R-S. That one started in China, and then it's called severe acute respiratory syndrome. Okay, it's another virus, and comes from the family of the coronaviruses. And so this particular SARS, because of the coronavirus, it has signs and symptoms of a common cold. Yes.
You said SARS started in China?
It started off, and then it trickled down to Mexico, to the United States. So we had this. This is the one. If you go back and you research it, you'll find that it was a really bad outbreak of it. Schools had to close down, and we literally, when we found that there was children that had it, we couldn't open the schools back up until we had literally disinfected and made sure that we had cleaned everything top to bottom.
Is that the big flu? The thing that happened in Fort Worth a couple years ago when they shut down all of Fort Worth? That was a problem.
Yeah. Some of you were younger and were probably elementary, middle school. Elementary, yeah, because it's been a while.
I think they shut down one. They didn't shut down last time.
Yeah, if they found one child that had it, they shut down the whole school and they send in, people to clean up.
My elementary school was shut down for a while.
Yeah.
We had to make that.
Yeah, and then that's why they started bringing in, hand sanitizers in the classrooms, Kleenex in the classrooms, because we wanted to make sure that we got you guys used to using Kleenex to blow your nose, sneeze into a Kleenex, throw it out, sanitize your hands, if you cough in your hands or sneeze in your hands. Because really and truly, the way that you should do it is cough and sneeze into your elbow, okay, into your clothes. Once it's caught there, it dries up and that's it. Okay, but when you cough and sneeze, the droplets are so small they linger longer in the air. Okay, so that's why it's very dangerous, and everybody can catch it. Okay, another one that we've talked about, yes, okay, is the West Nile virus. Okay, that's another one that we're still dealing with. It's a mosquito bite from a mosquito called flaviviruses, and it infected birds first, okay, and then now it infects humans. Okay, it's sort of like that new one that is out there that right now we haven't heard much of anymore, with the exception of those two. And now they said that it is also sexually transmitted, so you have to be very careful. Okay. The other one is your monkeypox. This one is a hantavirus. It affected monkeys, but somehow now it infects humans. It also rodents, and so it mutated, and so now it infects humans as well. Yes,
Isn't that in the same classification as Marburg?
I think so. Yes. Yes. We find it in urine and stool. That's where this particular virus gets excreted. And so we get it by contaminated food and water. Okay. All right. Let me see. What else here? You've heard about the one that we had, what was it, last year? That was called a hemorrhagic fever. That was caused by what? Happened last year, guys. What was the name of it? And we had cases in Dallas. Ebola. That's a virus too. Okay. Ebola is also considered a bioterroristic virus that can be used to kill many large groups of people. In the CDC, they actually have it because they've always tried to figure out how can we, prevent, what can we do, can we come up with a vaccine. So in CDC, in the Centers for Disease and Control, there is a lab called the Lab Level 4. It is this Lab 4 is where we have the most contagious viruses and even some bacteria, okay, like anthrax, that can kill large groups of people in an instant. Okay? Yes, ma'am.
Isn't that where they have the replica of the Spanish flu?
Yeah. In the CDC is where, in Atlanta is where we house all of this because we have technologists working, in infection control, and infectious disease doctors working on them trying to find vaccines and ways of eradicate them in case they were used as bioterroristic weapons, because they can be. Okay.
So we have
We have these viruses and bacteria because we're trying to find out how we can come up with vaccines or medications, and that we could have in an instant if we got hit with all of the stuff.
So like we could weaponize those, like if they wanted to.
If
they would.
yes, if the United States wanted to and they really wanted to create havoc on somebody, yeah, we have the capability of doing it.
What are we talking about?
Bioterrorism. So yeah, we have the technology, we have the viruses and microorganisms to do that. We just choose not to do it. Yes.
Isn't it against the Geneva Convention?
Yes, sir.
Well, weren't they also like recently, well, not recently, but a couple years ago, wasn't there like chemical weapons in Syria and all this stuff going on? So it's just basically like all the countries powers have the capabilities to do it. Like they have chemical weapons, they just don't use them. Right? Is that what you're saying?
We were talking about the United States. We have the capability of doing it. Other countries are using them. And Syria is being, if you remember, Syria had ties with Russia, and that's why they have what they have, you know. But through the Geneva Convention, we are not supposed to use those things. Okay, it's illegal.
It's a lot of things.
Well, and that's what I'm saying. I mean, that's why they're being looked at in a bad way, because they're using things that they were told they couldn't use, and they were part of that Geneva Convention. Okay, so yeah, I mean, can we do it? Yeah, we can, but we choose not to because there's no reason for us to go out doing that. Okay, I mean, maybe there is something in there, but we want to make things the right way, or do things the right way. So that's what we're using. Okay? Any other questions that you might have? The other one on the Ebola, which is also, and the Marburg, things that, signs and symptoms you'll see is fever, chills. You'll also see headaches, malaise, which is muscle pain. You'll see a skin rash, and then you'll start with failure of the organs, and then of course the famous, with Ebola, the famous bleed. Why? Because, excuse me, the virus attacks your coagulation system, attacks your liver, and so your blood has no way of coagulating, so you technically start bleeding from all orifices. You can bleed from your eyes, your nose, your ears, your anus, you name it.
It's
Okay?
possible to bleed from your anus.
With Ebola, yes.
So,
And then hemorrhoids is also another way of bleeding. Yes, ma'am.
so it attacks the liver.
Yes.
So what happens?
Ebola will attack the liver, so you have liver failure, so you no longer have our coagulation factors, and then vitamin K are produced in the liver, and those are the ones that help coagulate blood. So when your liver is to that damage, or we have that extent, it can do its job. So yeah. That's why you'll see them, that they literally bleed. Yeah. Okay. Questions with any of these? All right. We'll stop here, and then the next class we'll talk about the hepatitis test and HIV in detail. And so make sure you have done your homework and turned it in, guys. Okay, or emailed it to me somehow. Okay?